Hi, everyone. I'm Katira Noviello Kapoor, and I'm the Senior Director of Health Promotion, Wellness, and Athletics at the 92nd Street Y. I'm pleased to welcome you to this evening's Spark Your Health Talk, Oral Health for Life, the latest research and advice from top dentists, with Dr. Robert Raimondi and Dr. Mark Sclafani of One Manhattan Dental. Oral healthcare has implications beyond appearance and can have immense impacts, for better or for worse, depending on the care we give our teeth, on various systems within the body. This should be a fascinating look into our daily self-care routines and how we can do even better for long-term health. We hope to see you for our upcoming Spark Your Health talks next week as well, including learning about power player nutrients that boost our mental health with Dr. Drew Reynolds on Wednesday, October 12th. And then on Thursday, October 13th, we welcome Dr. Ellen Sherrill and Dr. Lou Bridges to discuss the joint and gut connection between arthritis and IBD, along with the latest treatment plans for both conditions. We will leave at least 15 to 20 minutes at the end of the event for Dr. Raimondi and Dr. Scalfani to answer your questions, and we may take some questions along the way as well. So feel free to be entering those in the chat box throughout the duration of the event. To learn more about One Manhattan Dental, please check out the links posted in the chat box. Now I look forward to introducing our speakers this evening. Dr. Sclafani received his Doctor of Dental Surgery and Certificate in Occlusion and TMJ Therapy from Georgetown University. He then returned to his hometown in New York, where he received his specialty degree in prosthodontics from New York University College of Dentistry. He began a private practice and taught at NYU College of Dentistry as an assistant clinical professor in prosthodontics for 10 years. Dr. Sclafani was recognized for his voluntary relief efforts for the chief medical examiner identifying victims of the September 11 tragedy. Following his undergraduate studies at Stony Brook University, where he received a bachelor's degree in biochemistry, Dr. Raimondi obtained his Doctor of Dental Surgery from the University of Buffalo. He performed his residency in general dentistry at Nassau University Medical Center before completing a 3-year program in prosthodontics at the Manhattan Veterans Affairs Hospital, while simultaneously studying at the NYU University Advanced Education in Prosthodontics program. He also teaches at the Manhattan VA Advanced Education in Prosthodontics program. Welcome, Dr. Sclafani and Dr. Raimondi. Thank you for being with us this evening.
Hi guys.
Hi there, everyone. Happy evening. So I'm Rob.
I'm Mark. Thank you for having us.
And so we work really hard with our patients to take exceptional care of themselves. It's kind of that complicated, that simple. And so today we're going to review some of the reasons why you might lose your teeth, right? How can you lose your teeth? And more importantly, how can you prevent it? And so we want to make sure that there's plenty of time for question and answer. So like Kat said, that during the process of the talk, if you have questions, mention it in the chat box. We're also preparing a really nice, if you're into podcasts, a really nice, like a show note type section that will be available on our website. But more importantly, we'll email it to you without you having to do anything. If you could just write your email in the chat box, the message box. We have a few people here helping us. Some of our team is here. So they'll record your email addresses so that we can send those to you guys as soon as we prepare it and make it look really nice and organized for everyone. And so please, all the questions are also available. Our email address may be there, but if not, you can find us by Googling us, and you can email us at office@onemanhattandental.com. And if you have any questions about anything that pertains to dental health, anything we talk about, anything we didn't talk about, let us know. We're here to connect and help and to give you any guidance or support with taking great care of yourself and staying healthy as possible. So with that, we'll jump into the first topic. Mark, go for it.
Great. Hi, I'm Mark. And here we're talking to you about how to not lose your teeth, how to help keep your teeth throughout your life. I want to start with a professor who means a lot to both of us. He was an orthopedist in Sweden, Dr. Ingvar Branemark, who coined the term, no one should die with their teeth in a jar. We both feel firmly about that. As prosthodontists, we spend a good part of our day, most of our practice, repairing, restoring broken teeth, replacing missing teeth. However, there's a good portion of our patients that come to us just for exceptional healthcare, who have no needs for dentistry, and just coming for cleanings, bleachings, and maybe some small fillings. Our goal is to better educate our patients so we can have a higher probability for them to maintain their teeth throughout their life. So the first thing we're going to get into is periodontal disease. Periodontal disease is one of the most common diseases known to mankind. It certainly accounts for 70% of tooth loss that we see in the population. 40% of the population over 30 years old has some sort of periodontal disease. 70% of the population over 65 years old has periodontal disease. Now, there's different stages of periodontal disease, which goes from healthy gums to gingivitis to advanced periodontal disease.
Dan, would you mind bringing up the slide there?
Thank you. I'm going to bring up a slide right now to show you the stages of periodontal disease. And as you can see above, there's two pictures right here. So periodontal disease in general is mainly the results of infections and inflammation of the gums and the bone that surround and support the teeth. From the diagram, you can see on the left, it shows healthy gum tissue. Further to the right is advanced periodontal disease. So let's look at the difference between the four pictures. On the far left side, on the healthy gums, you'll see pink tissue. It's firm to touch. It's not bleeding. It's healthy. On the bottom left picture, there's a little probe that is between the tooth and the gum. A periodontal probe is something that a dentist or a hygienist will use to measure if there's any pocket depth between the tooth and the gum. What I mean by pocket depth is the little space between the tooth and the gum. On a healthy dentition, that pocket depth will be between 1 and 2 millimeters on the picture on the left. As we go over one picture to the right, you see a little bit of inflammation. The tissue is red. The tissue is bleeding, possibly. It's inflamed. The probing still may be 1 or 2 millimeters, but this is early signs of periodontal disease. The good part about gingivitis is that it is reversible. It can be cleaned off your teeth and prevent further tooth loss. Now, periodontal disease is caused by bacteria in the mouth that infects the tissue surrounding the tooth. This causes an inflammation around the tooth. If the bacteria is left on the tooth, it's a thin substance that we call plaque. It's a film that's surrounded by the tooth that can easily be brushed off, or it can be removed by flossing. If it's not brushed off and it's not removed, it will then calcify, and it's known as tartar or calculus. So the two pictures on the far left shows advanced periodontal disease, moderate to advanced periodontal disease. On these conditions, the tartar is present. It's adherent to the tooth. It is disturbing the collagen and periodontal fibers that connect from the tooth to the gum tissue. So when this is present, there's blood, there's inflammation. The probing depths will be over 3 millimeters, in some cases 7, 8 millimeters. This is where we're moving to an advanced periodontitis. This is where patients can now possibly are at risk of losing their teeth because the tooth starts loosening up within the ligament. And this we see leads to advanced tooth loss. We'll get into detail later on proper home care, how to do this, but basically the main cause of this is plaque, which turns to calculus and tartar, and it's usually due to improper home care. Thank you, Dan, with the slide. So talking about this, we can leave the slide up, we can refer back to the slide if needed. Some of the warning signs of this we should all be aware of is, number one is bad breath. You'll taste a foul taste in your mouth that won't go away. If you look at the pictures that I showed you, another telltale warning sign would be red or swollen gums, possibly also bleeding. They'll be tender to touch. The teeth can be starting to get loose in the mouth. These are all warning signs that you should look for. But from the beginning, it's going to be sensitivity when you brush, when you floss, possibly bleeding. The gums can also start getting pulled away from the tooth. If there's enough bacteria between the gum and the tooth, we will see this where the gum starts getting pulled away from the tooth. For those of you who might be wearing removable devices, such as a partial denture that replaces some of your teeth, you may see that these devices don't fit as well as they used to because the teeth are moving as periodontal disease increases. So how is this diagnosed? Basically, a dentist could diagnose this by radiographs, by probing depths that I mentioned. A good dentist is going to probe your teeth to see if there's any bone loss between the teeth. And it's diagnosed by inflammation and bleeding. You're going to know yourself. When you get in there and you floss, when the dentist starts examining you, you're going to say, ouch, it's going to hurt when you're in there. So these are different warning signs. that can lead to periodontal disease. Go back to the slide once more, Dan. So you may have some questions, and we could pull this slide up again later. I just want you to be clear on the difference between the slide on the left that showed gingivitis compared to the slide on the right that shows advanced periodontal disease. The one further to the right, you can see the periodontal probe is well under the gum because there's hard tartar that's stuck to the root. You can brush and floss all you want. This tartar is not coming off unless it's mechanically moved by a dental hygienist. Unfortunately, when it gets to this point, it is irreversible. You won't get that bone to grow back. And we can talk into what type of dentist treats this. In a situation like this, we would refer you to a periodontist. So we'll get into more details about that later. So there's other risk factors. Thank you, Dan. Risk factors that contribute to periodontal disease. Smoking is probably the number one cause. Besides causing cancer and lung diseases, smoking is one of the major contributors to periodontal disease. It disturbs the microflora in the mouth, which is the bacteria. So you want to stay hydrated, drink some water. When the bacteria in the mouth is disturbed, it's better environment for bacteria or sugars in the food and carbohydrates to stick to our teeth. Another risk factor is diabetes. There's evidence that shows that there's support, that there's a two-way relationship between periodontal disease and diabetes. What I mean by that is diabetes can increase the risk of periodontal disease, and periodontal inflammation has a negative effect on glycemic control, 3 times risk factor. Stress is a big factor. That's the next thing I want to mention. Stress is a factor in periodontal disease. Research demonstrates that stress can make it more difficult for the body to fight off infection, including periodontal disease, obviously. The next one I want to talk about, unfortunately, is hereditary. You can have a great home care, but there is some studies that show that we get from our parents, and some people, unfortunately, inherit periodontal disease passed on from the cells from their parents. Next, I want to look at is crooked teeth. If your teeth are malaligned, if you never had orthodontics, teeth are crooked, they're not lined up properly in the oral cavity, it's much more difficult to clean between them. It's much more easier for plaque to sit between the teeth when they're not lined up straight. It's more difficult all the time. It's more difficult to floss. We send so many of our patients to orthodontics for care. They have great home care, but just the teeth are crooked and they're overlapped and they just can't clean properly in between them. A lot of old dentistry. A lot of people have old dentistry in their mouth, which is okay. And sometimes dentistry can last many years. But the margins of their old crowns and old fillings are chipped and the surfaces are rough. It's just an area for bacteria to adhere to and cause more inflammation around the gum. Same with old bridges, old dentistry that's bulky down at the gum line. Any bulky dentistry that's not fitting well, it's an area for plaque to accumulate down the gum line where periodontal disease normally starts. And it's going to increase and get worse if it's not taken care of. The last factor is we see in females a lot with hormonal changes, pregnancy gingivitis, the hormone shift when women are pregnant, on oral contraceptives, and this can change the environment and make people more susceptible to periodontal disease. Rob and I talk a lot about diet with our patients. Diet and drinking a lot of water. Important nutrients can compromise, a diet that's low in important nutrients can compromise the body's immune system and make it harder for the body to fight off infection.
Yeah, the thing you'll note as we go through all the reasons why you may lose a tooth is that there's a huge symbiotic relationship with your systemic health and your dental health. The things that you do for your teeth, your mouth, play a role in your body's health and vice versa. And I think that's a common theme that we're going to go through every topic. And I think it's refreshing in a way, because if you need some motivation, if you need a reason strong enough to take care of your health, yourself, and to floss and to brush and all the stuff we'll go through later on, stay healthy. It's not just your mouth.
It's your diet, it's your weight control, poor nutrients, obesity can lead to periodontal disease.
Everything.
Yeah, so those basically are the risk factors and causes. We can get into a little bit. A lot of this is going to be overlap that you're going to see
In a good way,
in a
refreshing way,
that
right?
we're going to go through.
Yeah.
Different ways. The number one way is proper home care to prevent periodontal disease. We have a question now. Do you want to stop for a question?
Gladly.
Sure, we had a question. Anything I can do to prevent this from happening, even if it might be hereditary?
Yeah, so, Mark, I want to ask Mark, why don't you finish?
Yeah, let me just start with
And
the
then we'll
ways
jump
that
into
we
that
have to prevent, and then we go
before
back
we
if
go
we
into,
miss it. So the number one,
next topic.
yeah,
We'll get
so
into
the
that.
number
Yeah,
one,
great.
whether it's hereditary or not, is proper home care. And we're gonna get into details on proper brushing, flossing, water picks, etc. But proper home care, which your dentist can teach you, they should show you proper ways to floss, proper ways to brush. Routine dental appointments. Our patients that see us at least every 6 months. People that have a lot of restorations in the mouth and are prone to periodontal disease are seeing us on 3 or 4 month recalls. Drinking a lot of water, high in pH, rinsing with water after you eat. We're a big fan of Fuji water, waters that have a pH higher than 7. Diet we spoke about, diet is included. Another way to prevent this. There are certain medications that can be used. Those would be prescribed by your dentist or your periodontist. One that jumps out is chlorhexidine. Chlorhexidine is an antimicrobial agent that acts on the inner cytoplasmic membrane. It acts against gram-positive, gram-negative bacteria, fungi, etc. They neutralize the pathogens, basically. So you want to get into questions?
Right, so,
now, or you want-
yeah, let's jump into the hereditary thing, right? So if you think about the second killer in our country, it's cancer, right? And 3% of cancer, 3% have a pure genetic component to it with no environmental factor. So that means that 97% of cancers have an environmental influence. So we have to think the same for a lot of different disease processes in your body, and including periodontal disease. I cannot tell you in my career, I'm sure in Mark's, like how many times a patient has said to us, well, my parents had periodontal disease and I have it too. So the thing we want to say in the most encouraging way is that you can do a lot for yourself to limit your periodontal disease. Like Mark said, and we'll go into that deeper, your proper home care, including the proper support with the right dental hygienist and the right dentist, is going to almost always have a huge impact in preventing the progression of periodontal disease and possibly preventing it even happening, right? So I could think about in our career, you tell me what you think, is a very small number of patients, a very small percentage, less than 10%, who have had hereditary factors that no matter what they do, they lose their teeth. There's not, I can think of their names on top of my head. I know their names in my head and the treatment we've had to go, and we'll go through treatment, taking out their teeth and replacing with implants. How many people, no matter what they've done everything right, they've lost their teeth. But that is by far a very small percentage of our practice. Very small percentage of our practice.
Sclafani could slow down that process, right? Like the proper home care, but
Home care,
very small percentage. of our
and it's a
practice.
real investment of time. And it's about the technique, it's about what you use, and it's a serious thing. It's a serious thing. The patients who are very susceptible joke about their partners, make fun of them, how much time they work on their teeth. For years a lot, right?
Yeah.
My patients, it says, oh, my spouse makes fun of me. They call me the dental queen, that I'm in there every night for 20 minutes, 30 minutes. I'm water picking, I'm flossing, I'm brushing, I'm doing all the things that make fun of me because they're in and out. And I'm there focused on and it's every day.
Yeah.
They don't miss a day. You don't miss a day. You don't shower, you don't floss and brush and all the things that they do. We'll go into that stuff, right? I think a few other things that Mark's talked about that I love to put on people's radars at your hygiene appointments, probing tests. You saw the picture that Dan was sharing with us of this probe going along the tooth. And he said 1 to 3 millimeters healthy, right? So sometimes you'll hear your hygienist or your periodontist or your dentist saying numbers, 2, 3,
3, 4, 5.
3, 4, 5. And that's referring to the depth. So just something to put on your radar. You can engage your hygienist and your dentist, say, hey, how am I doing? Where are my problem spots? Where are the spots that are more than 1 to 3 millimeters? Where are my 4 and 5s? Those are the areas that you probably spend a little more time with your hygiene, right?
So everybody on their recall and their hygiene appointments should have a hygienist that's using a probe in their mouth and measuring for these pocket depths, so you can catch it sooner than later.
Does periodontal disease hurt?
Periodontal disease doesn't always have to hurt, but most of the time it does. It can go undetected for a long period of time.
Right, mild,
Yeah.
moderate.
Yeah.
You have no physical
No.
awareness of this
And
happening.
again, the early stages, gingivitis is before there's any bone loss, it's reversible by proper home care. Advanced stages is not reversible, but you can stop it from progressing and getting worse. Unfortunately, as it progresses, you lose bone. That's when you get the spaces between your teeth. The food gets stuck in between the teeth, and now you get more prone to more diseases and more caries. Which brings us into the second topic of
We'll get to caries, yeah.
caries.
I think the other thing I want to spend before is you mentioned too that I love is how many patients do you send for adult orthodontia for non-aesthetic reasons, but for health reasons?
Every day.
Every day,
Every day.
right? Every day.
It's a common thing I tell my patients. Most of the adult population, their lower front incisors, the four front teeth, are crooked and overlap. And those are the four teeth that we see that patients lose first in their mouth.
Yeah, for sure. For sure.
The first ones to erupt in the mouth and the first ones to come out in the mouth usually.
Yeah, so adult orthodontics is something we advocate for a lot of our patients. And the third reason would be aesthetics. The first would be the health of the periodontium, the health of the teeth, the cleansability. The second would be the functionality of the upper and lower teeth together, which we'll get to also. And the third would be aesthetics. It's always a funny conversation. You have someone in their 60s, like, what do you mean I'm going to brace it?
And most people that do braces just to line them up and make them look pretty. But
We've done plenty of
it's
patients
more
do
about
that.
function and keeping your teeth.
Funny picture in their 80s, early 80s, getting orthodontics,
So many.
right? I love that. It feels like it's great to have that. Dan, would you pop up the first picture of the cavity? So we're gonna jump to the second most common reason people lose teeth as cavities, right? You'll see a picture that Dan's gonna pop up of the location that you can get a cavity. So they commonly happen, the chewing surface of the tooth. So the top of the tooth, on the bottom picture, you can see that. And on top picture, you can see how it happens on the side of the tooth. So very commonly between your teeth or very commonly on the chewing surfaces. So, what is a cavity? It's exactly what the word is, a hole in your tooth. So every time you eat, every time you function on your tooth, some of the mineral surface breaks down on the tooth surface. And over the time after you eating, the time after you chewing and functioning and swallowing and digesting your food, your saliva has minerals in it, and it's actually replenishing the tooth surface. It's buffering the acid and replenishing. So there's this common play that's happening between the insult and then the repair of the insult. And then what happens through the process is in a pH low environment, an acidic environment where there's carbohydrates, strep mutans, the bacteria that causes cavities can infiltrate the tooth. It really loves the environment. It loves the carbohydrates, sugars, starches. It loves the acid, and it just eats on it and actually forms this acid product that digests the tooth, it breaks down the tooth. And so it's when that balance is thrown off, is the opportunistic bacteria can win and cavitate the tooth, resulting in a cavity, right? This leads to the breakdown of the tooth. So many cavities can progress without you knowing it, right? Just like periodontal disease. Part of the problem with a lot of diseases in our body that aren't involving our mobility, like muscles and bones, you're unaware of. And hopefully, if your hygiene is good and your diet is good, you can help to really limit that by supporting your system and your immune system. So bacteria cause cavities, and the environment that you have for your mouth can help support them. Like I said before, strep mutans. Periodontal disease is caused by a plethora of bacteria, where cavities are really formed by two, strep mutans and lactobacillus. And the interesting thing that the strep mutans is the predominant cause here, which is actually to our benefit because we can target it. We can really target this bacteria through a lot of things that we do. And so aside from the bacteria, the things that support that bacteria are things like Mark said, the dry mouth. You'll see, like we said before, there'll be so many recurrent themes that if you have a really good foundation, you're going to knock out a lot of the reasons you could lose tooth. So dry mouth, tobacco products, alcohol, dehydrating products, things of not drinking enough water is a huge problem. You'll see during the presentation, of course, we're talking about, so we'll be drinking a lot of water, but it's a real mission. I'm trying to drink a lot more water always. This is like my mission this year. Take half your body weight in ounces, and that's how much water you should drink in a day. Now try to get that water in before not too close to sleep, so it's not impairing there. The other major problem that we experience with so many of our patients is medication. Medication can cause dehydration, right? It can cause a reduction in your salivary gland. So high blood pressure medication, anxiety medication, antihistamine, decongestants, muscle relaxants, pain medication. It's one of the most common side effects of medications that cause a dry mouth. And of course, one of the biggest insults for cavities is inadequate home care. The studies on flossing are interesting because they show somewhere between 10%, 20%, 5% of the population flosses. So in that diagram that Dan shows you there, one of the most common places where cavities occur is between your teeth, not breaking up your teeth, right? If you had to do one thing, brush or floss, you should floss. It's a funny saying to say, but statistically speaking, most of the dental disease, periodontal disease and cavities starts and progresses between your teeth. By flossing, you would stop it. So most people brush, most people do not floss. And this, like I said before, the early stages, the medium stages, the moderate stages of cavities, you're not feeling it. You're only feeling it as it gets closer to the nerve, as you can see in the photograph, right? The diagram is further to the right, as it's infiltrating or getting close to the nerve and penetrating that nerve. That's when it starts to become sensitive to hot, cold, and sugar. Lingering pain, sensitivity to those insults. You should talk with your dentist. You should go in, maybe have some radiographs and have it evaluated. So how do you prevent cavities? How do you prevent the progression of cavities, and how do you prevent them from happening? Of course, everyone knows fluoride. So we're going to recommend that people expose their teeth to fluoride at least twice a day. Of course, it's in tap water in many communities. Plenty do not have it. They found that as communities started adding fluoride to their water, there was at least a 25% reduction in cavities. But there is still some controversy. There are some groups on Facebook, on the internet, that talk about the problems with fluoride. Is fluoride bad? And so, for one thing, yes, you can have too much fluoride. Like everything there, the poison is in the dose. If the dose is the poison, how much you consume of it is going to cause a problem. So most communities have just under 1 milligram of liter of fluoride. So it's around somewhere between 0.5 and 0.2 milligrams per liter of fluoride. The lower limit is set between 1 and 2%, I mean 1 to 2 milligrams of fluoride per liter of water, but you'll find almost all communities have it lower. And so a few of the studies that found that there were some negative impacts of fluoride had 11 milligrams per liter. I mean, nowhere in our country is it even close to that. So the study that had a reduction in IQ, and I've heard podcasts of people talking about how they avoided giving their children fluoride. I'm not so sure that's the right message for people to hear, because again, as long as you have it at a therapeutic dose, it's something that can really help reduce cavities. And so what's happening is it's actually doing a ton of stuff to help prevent cavities, right? It's helping to add the mineral back into the tooth. It's actually bonding to your tooth surface. It's disrupting bacterial metabolism. It's reducing the bacteria being able to infiltrate your tooth. So if it bonds to the tooth, your bacteria can't then break it down. It's bonding stronger than the calcium phosphate molecules that were there prior. The other thing that it actually has to do, that bacteria can uptake the fluoride and it decreases their ability to adhere to the tooth surface. So the beauty of fluoride and why it's so popular and why the ADA recommends it is that it has this multifactorial approach to decreasing the risk of getting cavity and the progression of cavity. Now, there's some other things that you can do if you're fluoride sensitive or concerned, or in addition to fluoride. Now, we have our patients add these in addition to fluoride. So there's calcium hydroxide paste. There's some different paste that you can put on your finger, rub on your teeth after brushing. MI paste, right? It's a great product that we recommend. Xylitol is a product that we love. Not a product, but it's an additive. It's a sugar. It's a naturally occurring sugar, and that's in gums, toothpaste, mouth rinse, mints. And you can do that between meals, after meals. You can use a xylitol toothpaste, a xylitol rinse. And xylitol is really amazing because of all your microflora in your mouth, it only targets strep mutans. Strep mutans take this up and it prevents their ability to progress a tooth into having a cavity. It's something that I love people adding. It's a simple thing to do. You can find it on Amazon, you can find it on the internet. There's a plethora of different products. You can find one that you like. I know Orbit Gum has it in it. And I think it's a great additive if you're having dinner, you're having drinks, you're drinking coffee, you're having snacks, to add it into your armamentarium of preventing cavities. Of course, another way of helping to prevent and identify cavities is dental checkups. dental checkups, having the proper evaluation with your dentist, right? So you want to make sure that you take regular radiographs, and we could talk about that for a moment. I think that's what we're talking about. The radiographs that most dentists have are digital at this point. The digital radiograph has an advantage of being very clear, super large on the screen, so it's very easy to read. And also, it's very low radiation. It's very low radiation. So if we take a set of bite wings, a set of x-rays, 4, 5, 6 x-rays, it's significantly lower than you taking a flight across the country. We get a lot of resistance every day in our practice about the exposure of radiation. Now we have people watching us who have suffered cancer, who have gone through radiation, who have to do scans on a regular basis. So we don't discount the load of radiation that we're getting. We don't discount that. But we also have to talk about,
You need to be thorough.
what are the impact of having an inflammatory infectious disease decaying your teeth? If the radiation is low and your oncologists and your physicians do not speak about what happens when you take a flight. Don't fly because you had to go through this treatment. Other way around. So it's just something that I think you should, it's worth looking at, and we should put this in the show notes about how much radiation, Dan, make sure we put this in the show notes, how much radiation goes through dental x-rays compared to normal activity, like when you eat a banana, things like that. And I just shut off.
Just walking around the city,
tracking
radiation.
And so radiographs aren't 100% reliable. So you want to have a really good team of hygienists and dentists to be able to take the information on x-ray, because there are cavities that do not show up in the x-rays. And there's a ton of artifacts on x-rays that show up that are not cavities. So you want to be really discerning. You want to have a dentist that's really careful, that's really able to look at the x-rays, look at your mouth, look at your susceptibility, and make a decision on what should we treat, what should we not treat, right? And the way to treat them are through fillings, crowns, inlays, by actually mechanically cleaning out cavity and then filling or restoring the missing tooth structure with either, like I said, a filling or a different material such as ceramic, gold. And so the people who can help you are your general dentist and your prosthodontists, right? This is what we do all day long. As prosthodontists, we aren't doing surgery or root canals, but we are fixing teeth all day long. And so if there are any questions about this topic, we could jump into it. If not, Mark, what do you
Yeah,
need to
so
add
Dr.
there?
Raimondi said, a lot of these aren't always visible. When they start off small, they may not be visible on an x-ray. If it's in the middle of the tooth, it's a small hole on the biting surface. It could be addressed with a small filling. It may not show up on an x-ray. Caries should never lead to tooth loss. Caries is really only led to tooth loss when it's gone untreated, when your patient's not seeing a dentist and the cavity then gets to the nerve becomes inflamed. That's when a root canal is needed. If a root canal is not needed, the tooth can crack behind it, and that's when the patient will lose it. That's when the patient can lose it. So in this day and age, with the advancement of dentistry and the techniques and radiographs, there's no reason for someone to have to lose their tooth from a
There's no reason.
cavity.
There's no reason. Nothing's worse when we have a patient who has turned down the radiographs year after year, and then boom, they come in with an excruciating pain for the toothache, and it's like
We saw so much of this after COVID.
We could have prevented
Patients missed their
We could have
appointments.
prevented
They came back a year later, and some people were still afraid to come out of the house, and they came back and small cavities and now large cavities, and now they're root canals, now they're crowns. Not only does it jeopardize your health, it's very expensive to treat. And it can be prevented.
And it can be treated simply with less appointments, less money,
And it's
less complication rate.
And the ADA has recommendations when you should take x-rays, when you should not. You know, we all go to our cardiologist once a year, and nobody resists when they say you need to check chest x-ray today. It's the same thing with dental x-ray. Don't need to be
They're
taken
worried
every
about it.
time you come into the office, but they need to be taken every 12 to 18 months. Not a full set, but enough to determine the health of the dentition.
Yeah, I think patients who have never had a cavity, you can go 18 to 24 months.
Correct. So it varies from
Most
individual
of
to
us,
individual.
us in this room and people watching this, we don't really fit that maybe. So something like every 12 to 18 months is being responsible. And I think if nothing else came out of this talk, if you're listening to this talk and you have nothing else out of it to get that, if your dentist is recommending radiographs, consider it for the right reasons, and look at it with them, ask them questions, evaluate, right? I mean, it can be really, really helpful in preventing the progression of it.
I like to be involved with my patient. I'll hand them an iPad with the x-rays on it and show them and explain to them, just like we did with the slides, where the nerve is, where the decay is. Let them be proactive with it. Show them with a digital camera in their mouth. Show them what a broken restoration looks like. It's all about educating your patient. The patient's educated, they know what to do, what's best for themselves.
Yeah, ask questions, right? Ask your dentist and your hygienist questions.
We have questions?
We have one question somewhat related from an audience member. Why do teeth get darker or black as I age? Is it cavities, poor care, acid reflux, stress, or something else?
All of the above, maybe, right? What happens as you age is if you look
So
at
the enamel.
exactly, if you look at the photographs, you'll see the anatomy of a tooth, and there's an outer shell of enamel with an inner core of dentin. The outer shell is just a couple of millimeters thick, but that's that translucent, really white, beautiful part of your tooth, really shiny. And so you see the picture, right? That's the enamel is almost too thick in that photograph. It's a lot thinner in real life. But as that enamel wears down from use, from acid, from brushing, from eating, from just frictional use of your teeth, the inner dentin, which is a little yellower, and that varies per person what that looks like. The other thing that can happen, like if you look at the photograph of the decay, as decay occurs, it gets hollowed out, so that can make a tooth look dark. If you have a silver filling, that'll show and resonate through the translucent tooth surface and look, look more dark, more silver, more gray. So it's all the above,
As the cavity progresses, it's just a thin shell of tooth structure, and the inside is hollow or dark. And like you said, with the enamel, as we get older, the enamel wears away for many reasons, from grinding, from clenching, from brushing too hard, chemical erosion. That's all going to wear away the enamel, which is going to give the tooth a yellow or a darker tinge, darker color.
Right.
That's actually covered a little bit in our next topic.
No, we'll get into that, but there's a real emotional aspect of this because it makes you feel older.
Yeah.
It makes you older. So when you have restorations, and if you're having a restoration for a functional and aesthetic reason, have a conversation with your dentist of how it looks is really important, right? I appreciate the respect and trust when someone says whatever you think, but I really appreciate and prefer that the patient has an engaging conversation with what their expectation of how they want to look, right?
Also with age and periodontal disease advancing, our gums tend to recede. When the gums recede, the root surface is more visible, which is a material called cementum, which is a yellowish in color. Any of you have crowns in your mouth that have been there for a while, you can see the gums are receded, and you can see the crowns are white and the root surface is dark. That's just a natural root surface, and the tooth looks darker, and it reflects right down by the gum line.
The lower anterior teeth, people really drives them crazy. And so, like Mark said, proper hygiene.
We do have a question about teeth whitening coming
Go
through.
for it.
Do teeth
Yes.
whitening systems offered by dentists for patients to do at home reduce the strength of teeth over time?
Great question. The dosage makes the poison. The dose makes the poison. So as long as you're using it at an interval that is appropriate for you, depending on your situation, with the guidance of your hygienist, your assistant, your dentist, no, it should not weaken your tooth surface. There are no studies that have shown that it weakens the tooth surface. If you did it every day for a year, yes, it's going to break down.
If you look at the over-the-counter products such as Crest White Strips, this is a hydrogen peroxide, not a carbamide peroxide. So it's not active as long. You can leave it in your mouth for hours. It will only be active for an hour or two. So you really can't weaken your teeth with the at-home products also. In-office whitening, in the dental office, it's monitored by the dentist. So it's done at the proper dose, the proper time. It's not left on the teeth too long, and it doesn't damage the teeth over a long time if it's done properly.
Something happened as dental whitening became popular and aesthetic dentistry became popular in the 80s and 90s. People were worried about the whitening effects of the tooth. Right? It's a bleach, it's a peroxide that changes the crystalline structure of the tooth just aesthetically. And people were very worried. There were a lot of articles about that. And this myth became about. And I tell you, it's almost like at least 50% of the patients who are whitening ask that question.
Yeah.
And as long as you're using it carefully, directed by your health professional, it will not weaken your tooth surface.
You could have more short-term sensitivity, especially in the younger population where the nerve chambers, the nerve canals are larger. As we get older, the nerves recede, the teeth become less sensitive. So there could be some short-term sensitivity.
And that just happens from the dehydration of the tooth during the process.
And then usually we'll put a patient on a fluoride supplement after they bleach to kind of minimize the sensitivity.
The other thing you can think about is using a sensitive toothpaste prior to whitening. So we like to recommend our patients using a Sensodyne or a similar type product like Colgate Sensitive for 1 to 2 weeks prior to actually doing a whitening at home or in the office, because that'll help to reduce that.
And there's no harm using these sensitive toothpaste 24/7. I'm a big fan of using those. As
Yeah, we'll
opposed
get to
to
that.
we'll get
We'll
to
get to
favorite
the
toothpaste
toothpaste.
later. Yeah. So let's move to the next, the
If
third.
there's no more questions, any more questions?
questions?
There is another question about periodontal disease, and if that is hereditary, should they be visiting their dentist more frequently?
Absolutely. If it's hereditary, it's not hereditary in everyone, but certainly.
What should they look for? If bleeding,
Certainly, I mean, you
right?
should know if you're going to bleeding, inflamed, if it hurts when you're flossing. And your dentist on a routine check is going to probe your mouth, is going to take x-rays. The x-rays are going to show the bone level, if there's any bone loss. And it's not everybody, it's not hereditary in all the population.
Right, we have patients who are extremely sensitive to periodontal disease. There are a few patients, or maybe a few more than a few, but there's a number of patients who come every 2 months because they have to, right? Like Mark said, inflammation and bleeding are the signs of recession occurring, the active process of your gums receding away from your teeth. So if that's happening when you floss and brush or bleeding, you might want to think about having a different strategy for taking care of your teeth, your technique, but also a more frequent interval with your dentist. Great, yeah, great question. That's really helpful.
So the third most common cause of tooth loss that we see is teeth fracture. And there's many different ways that teeth can fracture. One that somebody just asked a question, one is age. As we get older, the enamel thins, the restorations kind of get loose in the teeth, and the teeth are more prone to fracturing when there's less enamel on the teeth. But we said earlier, old restorations. Some restorations can last 20, 30 years, I've seen in the mouth.
Yeah.
Some of them that are not done properly will separate from the teeth and can possibly cause tooth fracturing. Oral habits, bad, biting on pencils, biting on objects, ice cubes, certainly can fracture teeth. Clenching, we mentioned clenching and grinding, other habits that we see. I always tell my patients, lips together, teeth apart. Your teeth should only touch when you're swallowing and when you're eating. If you're spending all day on your teeth, clenching and grinding, even a healthy tooth without a restoration can split in half and could be fractures. Hard foods, candies, ice cubes, things like that should be avoided. Granola, popcorn kernels,
Nuts.
a good diet's going to help prevent this. High in vitamin A, vitamin D. Obviously, local checkups. The dentist is going to diagnose if the tooth is more prone to fracture. But then again, I mean, I've seen people come in the door with no restorations in their mouth, and they're just heavy clenches, and they split a virgin tooth. A tooth without a restoration can be split if the forces are strong enough.
I think this is something that is never talked about, never on patients' radar. But they fracture teeth from clenching and grinding over time. Dramatically weakens the tooth.
Trauma is obviously is up there on the list. Sports injury, getting hit in the face, can knock out a tooth. Brushing and grinding, we mentioned. Treatment for this would be possibly an occlusal guard. If someone's a heavy clencher or grinder, we recommend making mouth guards to wear at night. So the forces are distributed on a piece of plastic instead of through the long axis of the tooth, fracturing a tooth. Anything you want to add on fractures?
I think it's something that's not on people's radar. I think that people who have had large fillings, very large fillings, go through a lot more fractures, right?
Yeah.
I think that sometimes patients ask us, oh, I hope you just do a filling and not a crown. Fine, because the short-term result is just a faster, cheaper appointment. The long-term problem of that is the tooth is more likely to fracture. So I always talk with patients about that, try to show them photographs, right? Dan, you and I were working on getting great photos, simple, quick to show people quickly why we need to do or why we want in our own tooth to do something more than just a filling, right? I understand the need of people wanting to do the cheaper, simple solution, but maybe it's not the best long-term. It's not reinforcing this functional thing in your tooth that's sustaining millions of trauma millions of chews and trauma over the course of every year. Teeth have had root canals, posterior teeth almost always should have a crown, right? You should almost always have a crown or some type of restoration covering the chewing surface, like an onlay. It doesn't have to be a full crown. There's newer materials now that will be more
A
conservative.
little more conservative.
Right? I think fracturing and the topic we're going to talk about next is acid and erosion are the two like most common, not on people's radar topics.
So one more thing, so picture like an old silver filling. We all have these amalgam fillings, which are silver and mercury and other metals in our tooth and in the center of the tooth. When you continue to function on that, the walls of the tooth expand, almost like putting an axe in a piece of wood. It acts like a wedge and the tooth could split vertically. And like Dr. Raimondi said, patients that have had root canals. When you do a root canal, you're eliminating the blood supply to the tooth, the nutrients. So the tooth, which is living tissue, is now dead, even though it's still in your mouth. I compare it to a tree that's uprooted from the ground. You can take a branch and crack it in half as opposed to a live branch that will spring back. So this root canal treated tooth is now more prone to fracturing. And that's why the crown is always indicated. The crown is circumferentially surrounding the outside of the tooth. Better hold it together, less likely to fracture. Still a fan of doing some small fillings and being conservative.
Absolutely.
When they get too large, you have to know if you're doing what the patient's telling you to do with a small filling, because they don't want to move to the crown, or you're really protecting that tooth like it should be protected.
Right, and the right dental professional, the team approach will figure out the right way to approach all these things, from your hygiene appointments to your radiographs to the solution of restoration, how to take care of your teeth. And the thing that Dr. Sclafani said that I want you to think about from a logical standpoint, a silver filling is this metal that's compacted into the tooth, right? And it's an amazing material that's not used anymore. We don't use it in our practice anymore, but it lasted forever. But structurally speaking, it didn't do much to actually support the tooth. The material we're using now for fillings is a bonded material, composite resin, bonded tooth color material. Great material that bonds to the tooth for 3 years. Right, for 3 to 5 years, it bonds to the tooth, and then the chemical bond between the restoration and the tooth surface breaks down. So now you have this filling that's mechanically, it should be mechanically wedged into the tooth, and it can survive longer than 3 to 5 years, for sure, especially smaller ones. But that chemical bond of bonding to the tooth and strengthening decreases, if not is completely eliminated, in a short amount of time. So when we're recommending our patients receive a restoration made of ceramic or gold, it's really because of the functional solution for that tooth that's going to sustain many chews over decades, right? And it's the right combination of being very conservative and then doing what's necessary for the longevity of a tooth, for the survivability of the tooth, from a time standpoint, from a cost standpoint, and from a procedure standpoint. The more procedures you have, the more times you have things done, the more likely it is to break down. So, all right, I'm going to jump into the next topic, and again, it's very similar to the fracture because it's not so much on people's radar, but instead of being this slow degradation that breaks the tooth, it kind of happens in so many patients over time, and that's erosion, the effects of acid. This is something that we've talked with our patients the past few years more than I've ever thought I would. And Dan, can you pop up the food impact slide of the pH? So your enamel, as we showed you before, had the degradation of it. It becomes soft and break down at 5.5 or below. The pH of acidic is yellow and goes to red. And so what you want to know is, as you're enjoying these foods, as you're introducing them into your mouth, they're starting to make your enamel softer. They're making your enamel softer and helping to support the bacteria that cause cavities and helping to actually erode your tooth surface. So we all know people, and some of us, including me, I have a tendency to drink coffee during the morning, or the first couple hours of the morning. And so that's washing my teeth with an acid, as you can see on this chart. Some of the things that you enjoy, it is really going to insult the tooth surface, really going to insult the tooth surface. Dan, if you go to the next slide real quick, I just want to show you, and this is all going to be, if you put your email there, we'd love to email you all these graphics, just so you can digest them and look at them and analyze them and see, like, oh my God, I do this every day. I do this every other day, and I'm causing some problems. So maybe I should make sure that after I have my coffee, my juice, I'm having a glass of wine. couple it with this, couple it with water, have water with your juice, with your wine, with your coffee, enjoy xylitol mints. And so, it actually breaks down the tooth surface and it wears it away. We see so many patients that have had occlusal or the chewing surface worn down, or actually along the gum line, there's these notches in the tooth surface. And that can happen from a mechanical abrasion from brushing your teeth with abrasive toothpaste and toothbrushes. But if you wake up, have a cup of coffee, and then brush your teeth are softer at that moment, and you're brushing them with a medium or hard toothbrush with a whitening toothpaste that's very abrasive. Think about that. Think about rinsing with water, something to buffer that. And so you're losing the enamel, you're wearing around the tooth. And there's two ways we think about this. So I spent a lot of time just now talking about the extrinsic factors of tooth erosion, things going from outside into your mouth. The intrinsic factors that we talk about, the most common thing is acid reflux, right? There's some tests that your physician can do. Some of you know you have it. You're going through a colonoscopy, they can pair it with an endoscopy, and they can help figure out if you're suffering from this. There's things that's called silent reflux, that you're sleeping at night and you're not even aware that you have it. Then we take someone like Dr. Sclafani said, who's grinding their teeth with acid reflux, and they wear down the surface of their tooth in a way that's accelerated. It's very prevalent. It's something that we see in more than half of our patients, and we try to strategize it. Drink water. Google what kind of water you're drinking, right? I suggest your smart water. Now, smart water has a budget of products now, but the original smart water is very acidic. Dasani, Aquaphor, very acidic. The thing that you might see on there that's very interesting, and my wife, she drinks it all the time, drives me crazy, sparkling mineral water. Very acidic, very acidic. So, I understand that it's part of enjoy it. People like to hydrate with it, but it's something that you want to think about when you're using it and how you're using it. And the thing I want to talk about that's very important to consider is we evolved having meals. We didn't evolve having snacks. 100 years, the past 100 years, the American diet and developed nations have had food as an abundance of food. This wasn't very long in the human population where this wasn't a factor, right? People evolved having meals. So the food you have at meals, I'm not so concerned about as a dentist. What I'm concerned about are the things you're doing to snack. What you're doing to snack and the things you're doing between meals are really, really, really important. Yeah, I think we have a question related to this.
Yeah, one of the audience members asked, chlorinated water seems to stain my teeth. Is there anything I can do to stop the staining or decrease the staining?
Chlorinated water. Interesting. I think you want to think about what kind of toothbrush you're using, what kind of toothpaste you're using, what are your intervals of getting your teeth cleaned, and what is the nature of your teeth? What are you doing with that water? Are you drinking tea? Are you drinking wine? Are you having a lot of things like pomegranate?
I think they mean in regards to a swimming pool.
Oh, I'm sorry, swimming pool. Don't drink the water in your swimming pool. Wow, I don't have a good answer for that.
Yeah, I'm wondering if the teeth are. Of course,
I don't have a great answer for
The
that.
teeth are maybe damaged already.
Prescription strength fluoride. Thinking about some of the calcium paste that we spoke about, maybe increasing the level of fluoride that you can take, or before you swim, just brushing your teeth, swishing with the toothpaste and spitting out and not rinsing with water. Strengthen your teeth before you expose yourself to chlorinated water might be the best thing, or switch to a salt water pool.
And rinse afterwards if you are.
Yeah, drink some water.
Yeah, we also had a question if you can address the issue of pre-medicating with antibiotics.
Sure. Yeah. So if you go to American Heart Association, Google American Heart Association guidelines,
They've just changed.
they've been changing a lot over the past few years, and so listen, it's a tough topic to figure out because most physicians, orthopedics especially, and cardiologists, they just do it. Just do it because the risk isn't worth not doing. The studies,
Listen to what your physician tells
you
you.
have to. You
Listen
have
to
to
what
listen
your
to your
physician's telling
physician.
you. We're not gonna tell you not to if your physician's telling you to pre-medicate.
Right, and if you look at the charts that are online, and Dan, we should put
On
that.
the other hand, we used to
in the notes
pre-medicate
also.
much more for heart murmurs, and doctors don't recommend that anymore.
Right.
So speak to your physician, and see if you should still be pre-medicating.
Luckily, there's been a lot of comprehensive reviews of the literature, and they pulled back a lot on doing this. And so, but we still find a lot of physicians that it's just a rule, they just recommend
They
it.
just recommend it.
And
It's
so
primarily just for match, right?
it's right, they pull back from clindamycin at least, so people who are still not kind of allergic can do amoxicillin, people who are can change to a different type of antibiotics who are clindamycin, not clindamycin anymore. And so it's a tough conversation, it's a tough topic, because you don't know the right thing to do. We don't know the right thing to do, right? We probably know that through basic dental procedures, there's not an insult to bacteria that's happening systemically more than what you do for your oral hygiene. But also the risk reward, right? The complication of taking a single 2 milligram dose of antibiotics probably aren't very high compared to having bacterial endocarditis. So maybe take it and then couple with a systemic, a gut-focused probiotic, yogurt, kombucha, something fermented food to help maintain your gut health. In addition with that, probably is a safe approach when it's recommended by an orthopedist or your cardiologist.
How are we at time? Should we move to home care?
If- Yeah, no other questions coming in right now. Something I was going to ask is, what do you wish patients would know? What do you wish that patients would ask you? How should patients advocate for themselves in the dentist office? Because I think sometimes they don't know the right things to ask.
I love that. And it's so funny, we're going to talk with that about iatrogenic effects and the impact of your dentist can have with you. So I think asking to explain what the problem is. Okay, so there's a problem. Periodontal disease, broken tooth. What is the problem? Why is it a problem? And then let's talk about, if I do not treat it, what will happen? Right? So, okay, so I have resorption on a tooth, which we didn't talk about yet, but I have this problem. What if I don't treat it? I have periodontal disease. What if I don't treat it? What happens? To really understand how high level the problem is. And then what are the treatment options? What are the outcomes of each options? How experienced are you doing these options? How many of these have you done? What would you, the question of what would you do if it was your mouth is very helpful for the right person. But it's the same joke that if you ask your waiter at a restaurant, well, what's great here? Well, you don't know their taste. You don't know how well they take care of themselves. So but it is a question that's worth asking because you can at least narrow it down. And so, having that engaging conversation, looking at photographs and radiographs, and then so important. And we encourage every patient of ours who's on the fence about something, get more information, get a second opinion, talk with someone who has experience treating that. So look for a specialist, who's reputable. Ask around, ask your physician, ask your friends, and ask the right friends, and ask the right physician, right? Because there are people who are going to value someone's personality better over whatever it is, right? And so really have the conversation with your healthcare practitioner about all parts of your body, because you are your best advocate. We're going to talk about that a bit. And that's something that's so important to us. You are your most interested party in your health, more than your healthcare professionals. Every time, for every procedure you have, for every appointment you have, you need to, stand up for yourself and really get informed and find the person that you trust for the right reasons, that is willing to have the conversations that are important to you and advocate for you the way you need to be advocated for. The right person. We're so passionate about this topic. We're going to touch about it actually the next topic. It's so important.
To move to healthcare, do we have enough for this? There are a few minor issues, but we really want to close it off with home care.
Yeah, so we have about 10 minutes left. So I would start to kind of pull together. We have 2 more questions that came in, but you can certainly dive right in.
Let's do the questions and let's
Sure.
tell people how we can help out with this.
The first is plain carbonated water as safe for your teeth as plain water?
No.
So not the, no.
No.
Carbonation on every level adds acid to the water. The best carbonated water is sparkling mineral water, which is the least insulting. The worst is seltzer. The worst is
Plain water is so much better.
plain water, and you can test your water. You can look up if you're drinking bottled water. You can Google the pH of your water, or if you go on Amazon, you can buy these little test bottles, like this little vial, little swab. You'll dip it in your water, and then on the vial will have an indication by color to show you where your pH of your water is. And you can do that with beverages and food. I have patients do that, and I advocate for it.
And bottled water doesn't have fluoride in it, so yeah, you should still be drinking tap water, especially children, to get your daily supplement of fluoride for the water.
Yeah. What else did you
Perfect.
have, Kat?
And do you agree dental care is a function of mental care? And if you could elaborate on that.
There are so many
Yeah,
articles,
go
there's so many
for
articles, there's so many articles that people that suffer from mental care drop off with oral care.
Don't clean the teeth
And
properly.
symbiotically speaking, the other way around. There are so many articles, a bunch of articles done in Europe that show as people lose teeth, they have a level of dissatisfaction, a lower level of self-worth. They feel more depressed about themselves than they thought. They've actually done this in London, in Eastern Europe. They've looked at populations and they've actually done self-reported studies, surveys rather, and they've asked them, how do you feel about yourself? And it's really amazing how much it impacts someone's self-worth as they lose teeth or as they suffer dental disease. I mean, people come in to us and their self-image is really broken because of some issues they're having. And I think that the thing that I notice is as patients age, they sometimes defer and not do treatment that they could benefit from because they don't want to go through it. And I just wonder what that does to you. Because the patients, I had a patient, one of my favorite patients was in yesterday, he's 90, and he does everything he needs to do. He says, Doc, treat me like I'm 20. And this guy, he's amazing, and he lives a life that I hope to live when I'm 90 because he's fulfilled, he's active, he goes out with his friends, he does a lot of other things globally about his life that has that same philosophical approach of taking care of himself. So I just want to, encourage you that there's something that you're on the fence about thinking about doing that can improve the way you feel about yourself, replacing a missing tooth, fixing something that's not so aesthetic. Maybe it's worth doing it. You can't measure. You can't measure the emotional impact. You can measure the cost and the time. Yes.
And we're also not as lucky as someone to be that healthy when they're 90 years
Yeah,
old.
he's great.
Do
Yeah.
encourage trying to get some of the dental work done earlier, as you get older, more medical complications, more medicines that you're on, and it makes it more difficult to do dentistry as we get older. So some people want to put it off. When you put it off when you're 75 years old, you don't want to be doing this maybe when you're 85.
Such a common conversation. And so let's
close up with some home care. So
more
important in these situations.
Yeah. And so what is the routine that we recommend for patients, right?
So we're a little anal about this. We go back and forth.
We
So,
obsess about this, right?
flossing, the order. So we like
Clean between your teeth.
Yeah, clean between the teeth. So I like to start off with the mouth rinse. Then I like to floss. If I'm going to use a water pick, that's when I would use a water pick.
Before flossing, we use a water pick.
Brushing, and then maybe a rinse again. I like to also include in there a tongue scraper. There's a lot of bacteria that sits on our tongue. So a rinse first, a water
Clean
pick,
between
a
your
floss between your teeth. Like Dr. Raimondi said, flossing is more important than brushing if you had to pick one, and then brushing.
Right, because fluoride and xylitol, whatever you're using in your toothpaste, can get between your teeth. You clean them. If you clean them second, if you floss after you brush, the medicinal aspect of toothpaste cannot penetrate the tooth surface. Can't kill the bacteria. It can't rebuild the tooth surface, right? And so mouth rinses, we're going to breeze through this real quick and with some more questions. But mouth rinses are divided into two categories, right? Cosmetic and therapeutic. So cosmetic is like soap. Soap freshens your breath and doesn't do much more. Therapeutic actually helps to kill the bacteria or help to replenish the oral tissues. There are ones with aloe, there are ones with antimicrobial, antibacterial agents, right? And we'll put this again, if you guys send it, we'll send you a list of all the things that we like to look for in that. So we love mouth rinses that are alcohol free. We talked about in periodontal disease and in cavities, dehydration is a real thing. Listerine, is like what 30 proof, right, or something along that. So it's going to have a large alcohol. It's going to dehydrate your tissues. And the next thing that we talked about, like Mark said, is cleaning between your teeth. And you know, the studies show that if you use two modalities between your teeth, a water pick, floss, or interdental cleaners like soft picks, it's even more effective to use two things.
It's better than a natural toothpick. A real toothpick between your teeth will wear away the dentin at the margin of the tooth.
Yeah. Toothbrush.
Toothbrush.
Brush. What do you think?
Toothbrush. You gotta use an electric toothbrush.
You have to. What do you do? What do you do?
Gotta use
There's
an
not a
electric
single
toothbrush.
person in our office that uses.
There are studies that show if you do both properly, you do the same with a manual, but most people do not brush properly. 2 minutes in your mouth, a minute for the upper, a minute for the lower. 30 seconds on the buccal, the outside surface, 30 seconds on the lingual, the inside
Dan, can you bring up
surface.
the oral hygiene slide real quick? And so what you'll want to see, it's so important, we talked about, you can talk with your dentist, is there's an approach that we tailor. This is beautiful. So we have this document in our office and we customize the approach for our patients. What toothpaste should you use? What toothbrush should you use? What mouth rinse? There's so many options. And so people always, you know, at a party, at a social event, so they're, what's the best toothbrush? Well, there's no such thing as the best toothbrush. But Sonicare, Oral-B, electric toothbrush are the best because they're timed. They tell you if you're brushing too hard. They do a better job without you even doing it.
If you brush too hard, a light's gonna go off, so you can't put too much pressure on the tooth. With a manual toothbrush, you could brush too hard, cause resection of the gum. You could do more damage than good.
Right, so use a softer toothbrush and use it gently in your teeth. Do not scrub your teeth. Do not push hard, do not brush hard. It's a slow, gentle brushing mechanism. Dan, can you jump to the RDA for tooth? So now toothpaste.
Toothpaste.
This is the best
You
thing.
need a small
Right here.
amount, the size of a pea. You don't need
A
2
larger
inches of
quantity.
toothpaste. This is the best shot. If you can take
It's
a
the best.
picture of
That's
anything,
great.
it's the RDA factor, the relative dental abrasiveness. If you see most of your toothpaste is the charcoal ones, the whitening toothpaste. A lot of these have abrasive particles in them that will wear away the tooth. You want to use a toothpaste with a low RDA factor. Those are the ones on our screen on the top in the blue. The first one shows just brushing with water without any toothpaste at all. We don't recommend that, but one of my favorites is Pro Enamel that I use all
Yeah,
the
we
time.
love Sensodyne products.
Sensodyne
right?
product. I
Sensodyne products
use
are
Sensodyne
typically
toothpaste all the
great.
time.
You need both.
The
Both of our
chocolate
patients.
toothpaste are no good.
No.
Wear-
Whitening
wear away the
toothpaste. Stay away
tooth.
from whitening toothpaste.
Unfortunately,
Stay
a lot
away.
of Crest toothpaste fall into this
Yeah.
category.
Crest is a little more abrasive,
A
right?
little bit more
And
aggressive.
anything that claims whitening,
Good question.
90-something% of them are not whitening through chemical process, but whitening by being abrasive and scrubbing the surface of the tooth. So the only thing, Mark, I just want to mention that the few things that we like, right? You know, I love probiotics, and you can
Yeah.
research oral probiotics. It's a lozenge you dilute in your mouth, or not that you dilute, but you let it break down in your mouth. It helps to repopulate the healthy bacteria in your mouth. Then you can get it off now. And people ask us a lot about oil pulling. And so oil pulling is something that you can do in addition to all the other things we talked about. It's not going to hurt you. I'm not so sure it'll help you, but you would use it after you floss and before you're brushing. There's some reasonable approaches of essential oils and some oil products.
The tongue scraper we
They're
mentioned.
not the nicest. You hate the oil.
I don't like them.
You hate the product.
We've tried a lot of these products and some of the new
They're
products.
a little.
The tongue scraper I am a big fan of. You want to work from the back of your tongue and pull forward. There's plenty of brands on the market. Dr. Tongues, I think.
Yeah, we
is
love
one of the
Dr.
most common
Tongues.
one that you can find. on the internet.
Listen, I think if there was one thing you get away from this presentation is that you can do more for yourself than anybody else.
We have another 2 hours of material. You guys can listen. But we could wrap this up and take questions and wrap into
Yeah.
another lecture another time.
So much information. This was absolutely incredible. We can't thank you enough. We have no more questions coming in, but we have some nice comments such as, thank you very much for a very informative presentation, doctors. You've talked about dental topics that most people do not hear about very often.
Right.
I agree. As I was writing the outro, I was about to say now we should all go brush our teeth, but now I will say we should all go floss our teeth or rinse, floss, water pick, brush, tongue scraper. So all of it. Thank you. Thank you again so much. I want to thank Dr. Sclafani and Dr. Raimondi.
Dan,
for
come
the
here quick.
excellent
Yeah,
discussion.
we want to just introduce us. Dan has been helping us with the slides as our new
Absolutely.
associate in the office.
Yeah,
One
no
of our
problem.
Dr. Dan Bernstein.
Hello there.
We're lucky to have
Helping us navigate everything. So please, if you have questions, we really want to.
Yeah, we're very passionate about this.
strongly
Reach out, engage
Yeah,
us.
Sorry, our cameras are going on.
I can see that. We are sending out the recording of this tomorrow, so feel free to send over the PowerPoint. I think there was some great content in there that our participants would like to see a little bit more clearly, maybe. So if you could go ahead and email those over, I'll get those out with the recording to everybody.
Great, great. Well, thank you for having us. We
All
really
right,
enjoyed
thank
this,
you so
and I
much,
hope we
Dr.
informed
Scalfani
you.
and Dr. Raimondi. This was wonderful.
Thank you.
Everyone for joining us and have a good evening.